20 reasons for a missed or irregular period. 20 reasons for missed or irregular periods. Are you experiencing irregular periods? Are you asking yourself what is causing these missed periods? This video is for you. This is Gerard Massa, the health educator, and on this channel we do create awareness about fertility and reproductive health. Remember, if you have any questions in regards to fertility, how you can get pregnant faster, you are having issues with your reproductive system, then this channel is for you. Ask me all your questions and I will answer them in the comments below. So without further ado, we are talking about the 20 reasons why you are experiencing a missed period or why you are experiencing irregular periods. Gerard Massa, the health educator, is the name of the channel. So the first reason why you are experiencing your missed period, why you could be experiencing missed periods, is that you could be having or you could be undergoing extreme stress. Extreme stress is reason number one why you could be experiencing missed periods or you are having irregular periods. Oli kwebuuza ku lwaki oli kulaba periods zo ng'ate ziri irregular, periods zo zikyukakyuka naye ng'ate oli kwebuuza ku lwaki oli kubanga ofuna embeera eno. We are saying that when a woman is undergoing extreme stress in her life, for example, if you are going through stressful conditions like maybe a divorce or any stressor which is happening to you, either from the inside, how you feel, or from the environment, then it could actually have an effect on your periods. So if you are a lady and you are experiencing extreme stress, just know that it's going to have an effect on your periods. Although many times the type of stress we are talking about here is not this common stress. You could maybe say that you've not gone to the salon or you've missed an appointment. The stress we are talking about here is extreme stress. Stress that affects you psychologically. What happens is that when a woman experiences extreme stress, there's going to be an effect on her hormonal levels. There's a particular part in the brain known as the hypothalamus. The hypothalamus is that part in the brain which actually releases, or it is responsible for releasing a hormone known as gonadotropin releasing hormone, GnRH. Now, this hormone acts on your anterior pituitary gland, and then there will be production or release of the two hormones, that is FSH and LH. These hormones travel to your ovaries and then they actually stimulate both ovulation and menstruation. Not of course at the same time, but when time for ovulation reaches, the hormones play their part. When time for menstruation reaches, still these hormones play their part. So if a woman is experiencing extreme stress, there are high chances that she is going to actually have issues with her periods. She might get irregular or missed periods. Next cause of missed or irregular periods is extreme exercises. When you are an athletic lady and you do workouts at least for 2 to 3 times a week, and then you are doing them for 30 minutes or even like 1 hour, this may not be considered too much. But if you exercise for hours, you exercise from morning up to maybe evening, there are high chances that you're going to actually end up having effects on your periods. Your periods will be affected. Tugambe nti obanga obadde oli mukyala ate nga olina embeera gy'oyitamu eya extreme stress, nga oyita mu mbeera ey'okubanga kwegamba oli stressed ennyo, changes zigenda kubeerawo mu periods zo. Ate ne tugamba nti obanga obadde okola dduyiro naye nga n'okola dduyiro ono ng'omukolera ekiseera ekiwanvu, nakyo kisobola okuviiramu embeera ey'okubanga periods zo zikyuka. So point number 1 is extreme stress. Point number 2 is extreme exercises. If you are exercising, you should do it in moderation. Do not over exercise, because if you over exercise hours doing exercises, then specifically there's going to be changes in your hormones. The hormones we are talking about here are those fertility hormones, that is FSH and LH. Remember, they are produced in a part of your brain known as the pituitary gland, and you are over-exercising, you are overworking this particular part, you are over-sweating, then there are high chances that these hormones may be suppressed. Thank you, my friend, for attending today's video lesson, and we are proceeding with our lesson. Just get yourself your pen and paper and listen to what we are talking about here, because it could help you in one way or another, or it could actually even help a friend. You can share this video with a friend so that they can also learn about the reasons why they are experiencing a missed period, or the reasons why they could be having irregular periods. Gerald Massa, the health educator, is the name of the channel. Remember to subscribe so that you do not miss videos we release every day. Next reason for a missed or irregular period is that you could be having thyroid disease. Now, the thyroid gland is that small structure which is located around in your neck area. That is the anterior part, the outer part of your neck area. Normally, it's not visible. It's not visible. The thyroid gland is not supposed to be visible. It becomes visible and it swells. It becomes like a nodule if at all there are changes happening to your body. I believe you've ever seen women with a swollen thyroid gland. Normally, it swells because of changes in your hormones. Specifically, when we are talking about the thyroid gland, the key hormones we are looking at here is, the first one is known as the TSH. That is the thyroid stimulating hormone. And then we also have these other hormones known as T3 and then T4. Now, when we look at TSH, that is thyroid stimulating hormone, then we look at T3 and then T4. These hormones are supposed to be produced in moderation. So if these hormones are overproduced or they are underproduced, in simple terms, a thyroid gland which is overactive or which is underactive is going to have a direct effect on your periods. So if you are experiencing missed periods or irregular periods, I'm not saying that it could be you could be having thyroid disease, but it could be something we need to look at. It could be something we need to investigate, because at the end of the day, if your thyroid gland is overactive or if your thyroid gland is underactive, then please, you actually should have yourself get checked out at the doctor, at your doctor's office, because if something which has been discovered earlier on, it's actually, there are high chances that it can be managed. But if you delay and by the time you go to hospital, when the thyroid gland has already swollen and it has come out and it is visible, it may not be good. It still can be treated. They can put you on medications. For example, iodine, but still there are high chances that it could actually take long. So have yourself checked out. We are talking about the reasons for a missed or irregular periods. 20 reasons for missed or irregular periods. And we are proceeding and we are saying that the next reason is you could be having what we call polycystic ovarian syndrome, abbreviated as PCOS, PCOS. Polycystic ovarian syndrome is a hormonal condition. It's a hormonal condition whereby a woman's body releases too much male hormones. That is, you as a woman, your body releases excessive amounts of the male hormone known as testosterone. Of course, the only way to confirm that a woman could be having testosterone is by doing some tests in the lab. They could take your doctor could take your sample of blood, a small sample, and then they will do what we call a serum analysis. They will look at the serum levels of this hormone known as testosterone in your blood. High levels of testosterone in a woman is an indication that there could be something happening. You could be developing polycystic ovarian syndrome. Of course, your doctor will go to the next step of checking your ovaries by doing what we call a gynecologic or pelvic ultrasound scan, where small fluid-filled structures known as cysts will be seen. The confirmation for PCOS or polycystic ovarian syndrome is by doing what we call the hormonal levels or the blood levels for testosterone. If your testosterone levels are high as a woman, please, this could indicate that you have PCOS. If you do an ultrasound scan, a pelvic ultrasound scan, and it shows that you are actually having lots of small swellings, okay? In Luganda, we call them obuzimba. If you are having small swellings on your ovaries, beginning from 9 and above, maybe you are having 10 or 15 or 20, then it's a confirmation that you are having polycystic ovarian syndrome. Remember, polycystic ovarian syndrome can be controlled by the use of drugs, and you can actually go on and get pregnant. I've had clients who are having PCOS, polycystic ovarian syndrome, being managed very well, and they are actually pregnant. Some of them have even given birth. So if you are a woman out there and you are having PCOS, you are having polycystic ovarian syndrome, please have yourself checked out, and I believe you can get better putting your trust in God. Next reason for a missed or irregular period is that you could be having what we call the pituitary tumors. When we are looking at the pituitary gland, we've said that it plays lots of functions in your body. But in this particular case, since we are looking at women's health, we create awareness about fertility and reproductive health on this channel. The pituitary gland specifically tends to be overactive or underactive. But when it goes on and it develops swellings or tumors, these could be benign or malignant, meaning these swellings could be cancerous or they could not be cancerous. These swellings tend to have an effect. Remember, we've said that the pituitary gland releases the follicle-stimulating hormone and the luteinizing hormone. These two hormones play a very big part in bringing about your menstruation, enabling you to see your periods normally. If the source of these hormones, that is the pituitary gland, if it is having a tumor, if it is having a swelling, and this tumor is affecting the production of these hormones, then you are actually most likely going to end up with a missed or irregular period. So if you are a woman out there and you are experiencing, you are missing your periods, you are having irregular periods, and this is becoming persistent, you should not just sit and wait. You should not just sit and wait for things to worsen. Kindly have yourself get checked out. You could be having a pituitary tumor which could be actually causing this. Now, this cannot be discovered by you sitting at home. You have to talk to your doctor, whereby they will do a full assessment on you. Reasons for a missed period. Reasons for a missed or irregular period. We are moving to our next reason, and we are saying that you could be having diseases, or you could be having a disease of the adrenal gland. Now, the adrenal glands are those small structures which are located just on top of your kidneys. The kidneys are those two structures which are responsible for the regulation of many processes in your body. Specifically, they deal with filtration. Filtration, as in blood comes in, enters your kidneys, and then it is filtered. Just as you can prepare passion fruits, you get the seeds from the fruit, and then you put them on that filter, and then you basically, that's how we do it here in Uganda. You actually put the filter on top of a cup or a container, and then you use a spoon to squeeze them. Now, what remains behind? The seeds that remain behind are thrown away. So when we look at the kidneys, they actually play something. They do act in something like a similar way. Blood comes in when it is packed with lots of things. It is packed with proteins, it is packed with blood cells, it's packed with lots of things. So the kidneys play that part of filtering, removing the wastes, which move down your two tubes, known as the ureters, up to the bladder, whereby when it is full, the sphincter muscles are stimulated to open. That is when you go for a short call, and then they open, you do urinate, and then the whole process becomes cyclic. It is repeated again. So when we take a look at your kidneys, the two adrenal glands, the two small structures which are on top of your kidneys, if they are having issues, if they become diseased, if they become, maybe they develop tumors, there are high chances that your periods will begin changing. I believe by this time you know that if you experience missed periods or irregular periods, it could be something simple. It could be that you're pregnant, by the way. It's among the other reasons we are going to talk about. So I've thrown it here, I've put it here. But actually, another reason for you missing your periods, it could be something as pregnancy. You could be pregnant, or you could be stressed. But beyond that, a missed period or an irregular period could mean something big. So you need to be checked out if you are missing your periods. It could be something simple, it could be something complicated. Next reason for a missed period, remember the last point we've just talked about is the disease of the adrenal glands. I hope you've taken note of that. The next point we are looking at, the next reason why you are seeing your missed periods, you are seeing missed periods or you are getting irregular periods, you could actually be having a condition with your liver. We call it liver dysfunction. The human liver plays a very big part in the metabolism, in the breakdown of lots of things. You take some drugs, these drugs are metabolized and broken down in the liver, plus other processes like fat metabolism. But here we are saying that when you develop liver disease, evidenced by lots of jaundice or yellowing of the eyes, and then of course increase of your liver beyond the recommended 15 centimeters, that is the mid-sectional diameter. If your liver swells, you go for ultrasound scan and your doctor tells you that you have a big liver. Your liver has enlarged, and even the blood vessels inside the liver are not visible. Maybe you could actually be having fatty liver, a result of consuming lots of sugars, consuming lots of fatty foods with no exercises. Then there are high chances that you could end up with a missed period or irregular period. Although the liver can only be confirmed that it is dysfunctional or it is having issues by doing some tests. The test we recommend here is what we call the liver function test, abbreviated as LFT. Now, I don't know which country you're from, but here in Uganda, the LFTs are done, and specifically, they can actually show how your liver is functioning. They will show the levels of some key ingredients, the key components of your liver. For example, bilirubin. Bilirubin is a waste product. It's a waste product of liver metabolism. But if at all it is beyond the levels which are recommended, then there are high chances that you need to be checked out. And then if some enzymes, for example, GGT, APT, and other enzymes in the liver, if the results come out and they are so high, then there are high chances that you actually could be having liver issues, and your doctor will check you out. So irregular periods or missed periods could also indicate that you have liver dysfunction. Next reason for a missed period, diabetes. Diabetes is a blood sugar disease. Blood sugar disease meaning that your sugar levels in your blood could actually be having, they could be changing. Normal sugar levels should be at least 3 up to 6.5. That is in some countries. Whereas in some countries, normal sugar levels are from 3.5 up to 7. So, but the recommended is 3 up to 6.5. If you do a simple blood sugar known as a random blood sugar, where a small sample of your blood is taken by pricking on the tip, and then that sample is put on a small machine for measuring sugar, known as a glucometer, and then the readings are 8. Or the readings come out and you are having 10 millimoles of sugar, millimoles of sugar, that is 10 millimoles of sugar. Remember, we've said that the normal is 3 up to 6.5. Then you do not have to worry. You need to sit down, have your doctor talk to you, and they'll explain to you the results very well. You could be developing blood sugar disease. And this could also be the one, or it could be the main reason why you are experiencing missed periods or irregular periods. So, another reason for missed or irregular periods is that you could be having diabetes. The other reason for missed or irregular periods could be that you could be having congenital abnormalities. These could actually be having a direct effect on your on your periods, making you to miss your periods or have irregular periods. The congenital abnormalities we are talking about here, number one, androgen insensitivity, and then also if you could be having issues with the Turner syndrome. Androgen insensitivity, when your body is no longer responsive to androgens, or basically the Turner syndrome, then there are high chances that you could actually end up with a missed period. Next is that if you have rapid weight loss, then it could also bring about a missed or irregular period. And also an ectopic pregnancy could be another reason why you are having a missed period. An ectopic pregnancy an ectopic pregnancy, also known as an extrauterine pregnancy, is a pregnancy that is outside the uterus. An ectopic pregnancy is a pregnancy that is outside the uterus. It could be in the tubes, it could be just at the junction of your fallopian tube. So anything that happening, normally it could indicate that you are having issues. When you begin seeing your missed periods, you do an ultrasound scan, it shows that your uterus is empty, but the urine pregnancy test is showing that you're pregnant. The pregnancy could be in the tubes. You still have to see your doctor or your gynecologist, and they will advise you on what to do. Next reason for a missed period is that you could be having what we call menarche. Menarche is basically the first time a girl is seeing her periods. This could also lead to irregular periods, but this does not last for the next months. There are high chances that your periods will go to normal. But still, if they do not go to normal, then please, you need to be checked out so that you can be treated appropriately. And then, lastly, you could be having what we call perimenopause or very early menopause. Perimenopause normally means that you begin your menopause earlier than what is recommended. So, if you are in your 30s, you are 35, and you've started getting irregular or missed periods, there are high chances that you could be having what we call perimenopause. 20 reasons for a missed or irregular periods. 20 reasons for missed or irregular periods was our topic for today. And remember, if you have any questions in regards to what we've talked about, you are a lady, you are having missed periods, irregular periods, then you could actually watch this video once again. Take your time, get your pen and paper, go through what we've talked about. It could be among what we've talked about, or it could not be among these, but still, these are the most widely common causes for missed or irregular periods. I will summarize and do a recap. Number one is extreme stress. Number two, extreme exercises. Number three, illnesses. Thyroid disease, Polycystic Ovarian syndrome, Pituitary Tumors, diseases of the Adrenal Glands, liver dysfunction or liver disease, diabetes, Turner syndrome, androgen insensitivity, heart attacks could also lead to rapid weight loss. And then, of course, they could also, as a result of the weight loss, then there are high chances that your periods may actually become irregular, or you could miss your periods. And then changes in your schedule. You've been working normal hours, maybe you've been working during the day, and then all of a sudden you are working even at night. You are working day, you are working at night. These changes in your schedule, the rapid changes in your schedule, could have a direct effect on your periods. Remember, we said that stress is the number one. So if the job is stressing and at the same time you are having missed periods, then just know that there's something connected with the stress you're going through at work and your periods. And then we also said that ectopic pregnancy, breastfeeding, and then perimenopause, there are high chances that these could be among the causes of your missed periods. Let me answer all your questions down below in the comments, and have yourself a fantastic and healthy day.